Gould of Potter Newton.
I beg leave to ask the question standing in my name on the order paper.
My Lords, we welcome the new HIV testing guidelines from NICE, which are particularly timely on World AIDS Day. Early diagnosis of HIV through increased testing carries huge benefits. Progress is being made, and in 2015, undiagnosed HIV fell to 13% from 25% in 2010. We will keep working with partners to use the guidelines to encourage people to get tested and fight the stigma associated with HIV.
I thank the Honourable Lord for his reply. Can he elaborate a little on the plans that the government has in order to, when promoting, as I hope he will, the guidelines, but to raise awareness and monitor the use of the guidelines in order to reduce 17% undiagnosed HIV and the continuing levels of HIV? The responsibility of government is, I believe, is absolute in actually making sure that the guidelines are adopted. But on the same basis, can the Minister indicate what support or otherwise the government is giving to ensuring that PrEP is made available for all those who might be at risk of HIV transmission?
My Lords, the undiagnosed rate of HIV is not 17%, as the Noble Lady said. That was last year, 2014. It's 13% now. So there is an improvement here, and the trend is absolutely in the right direction. We have a whole range of programmes to try and improve the rates of testing, from self-sampling. I think 1.1 million people attended GUM clinics last year. The HIV Innovation Fund, all the work being done by the Terence Higgins Trust. On the matter of PrEP, there's a particular question that's coming in a couple of questions' time. Perhaps I could deal with the PrEP question in a couple of minutes' time.
My Lords.
I actually was part of the innovation panel for Public Health England, so I must declare that.
My Lords, all those living with HIV, and in particular those diagnosed late, require very significant levels of care, both for their physical health and their mental health. Will my noble friend agree with me that specialist doctors and nurses in the NHS provide exceptional levels of care for those living with the virus, and join me in particular in paying tribute to the work of pioneering centres such as the Ian Charleson Day Centre at London's Royal Free Hospital, which have made real difference to the lives of thousands of patients?
Well, I'm very happy to do that. I mean, it is extraordinary how the healthcare has changed a fatal disease into a chronic disease in the course of just 20 years. And just a quote from the report by PHE that was produced today from a white lady who has HIV. Just a few words from someone who has been living with HIV for nearly 20 years. It's not that bad, and there are times when you forget you have HIV. Eventually, even when you remember you're positive, it's no longer an issue. I mean, that, I think, is an illustration of just how far we've come in 20 years.
My Lord, can I ask the Minister if he would agree that it's very dangerous to go around if you don't know your HIV status? And would he organise some more publicity, particularly for women, because men seem to have more help than women?
The Noble is absolutely right. Early diagnosis is absolutely critical. We've made huge progress. The WHO guidelines aim for 90% of people to be diagnosed with HIV. We are now 87%. Sweden is the only country in the world that has hit the 90% target for the WHO has said. But I can entirely agree with it. And I would just point out the It Starts With Me programme, which is very much based around individual responsibility, which is coordinated with the Terence Higgins Trust, which is making great progress.
My Lords, I very much welcome the initiatives taken by the government in this area. But would he accept that there's more the NHS itself could do, particularly in accident and emergency departments and in primary care? And I just wonder if you'd be prepared to convene a meeting with NHS England to discuss how the NHS itself could be persuaded to be much more proactive in relation to testing.
Well, of course, I'm very happy to arrange a meeting of that kind. I think we are expecting an announcement very soon on the PrEP issue, and it may be after that announcement it will be worthwhile having that meeting.
I think it is the turn of these benches. My Lords, a high percentage of people living outside London are unaware of their HIV infection compared to London. It's 24% compared to 12%. Is the government doing anything in the regions to replicate the good practice that we're beginning to see in London so that that situation disappears?
Well, I think the reason why more is done in London is simply because there is a greater incidence of HIV in London. But I wasn't aware of the difference, actually, between those two figures, between 12% and 24% that the Noble League. I'd like to look into that and write to her on that point.
My Lords, one of the largest groups within the population who have got this disease through heterosexual transmission is the British Black African community, both men and women. There are actually 30,000 cases. And as of last year, the estimated undiagnosed cases were actually increasing within this population. So could my noble friend the Minister please outline what initiatives are specifically aimed at raising awareness and avoiding the late presentation which is prevalent among that community? And in particular, many of that community are members of faith institutions. What is being done to engage them in raising awareness?
Well done. The black African male and female community are a group that are especially vulnerable to HIV and have identified in the work done by NICE and of course as a part of the population where special efforts must be made to increase early testing. And the work done by the Terence Higgins Trust, the MARPS programme, has also identified that community as being extremely important. And I think we will see greater targeting of the about 13,000 people of the population who are living with undiagnosed HIV.
The Noble Lord, the Minister, referred briefly in his opening answer to the question of stigma. I don't know whether he will have heard this morning, probably not, he was probably working already, the Today programme, where there was some testimony from people living with AIDS, which showed that they were subjected to really shocking levels of prejudice, and most of that appears to come from ignorance. I wonder whether he could expand a little on what the government is doing to encourage the right kind of information, not just for people who have or might be vulnerable to getting AIDS, but to the wider population whose attitudes are frankly a little bit prehistoric in quite a lot of cases.
Yeah. Well, that's a very insightful question, if I may say so. I think if you look back over time, it is a lot better than it was. But I think what the Noble Lady is saying, it is still far from good enough, and that this is an education programme that needs to go beyond just people who have got AIDS, but to the wider population to get a greater degree of understanding. I wonder if I could just investigate that issue a little bit further and write to the Noble Lady.
Lord Collins of Highbury.
I beg leave to ask the question standing my name on the order paper.
My Lords, our youth framework puts young people at the centre of international development efforts. Tackling youth HIV, including among key populations, is critical to ending AIDS as a public health threat. Our investments support young people to make safe, healthy and informed choices to protect themselves and their peers from HIV and other life-threatening illnesses.
I thank the Noble Lord the Minister for his response. I'm also pleased to see so many red ribbons being worn today on World AIDS Day. We know HIV and AIDS has a disproportionate effect on the most marginalised groups in our society, particularly men who have sex with men, drug users, transgender and sex workers. Such people might not be able to access services which are integrated into broader health systems for the obvious reasons that in some cases they may be ending up in jail. Could I ask the Noble Lord, the Minister, whether he is prepared to review DFID's approach to HIV in its programmes, to assess both HIV-specific programmes and programmes which address HIV within the broader health and development interventions?
Well, the Noble Lord and I had a very interesting afternoon yesterday in terms of attending the Stop AIDS conference, and there were some incredible presentations which were given there, and a lot of information there. Of course, given it's such a huge health threat globally, as well as in this country, it is essential that we do everything and remain open to new information when it comes. We are the largest, second largest contributor to the Global Fund, which is doing tremendous work in this area, 1.1 billion, just announced in July. But there is more to be done. There is an International Development Committee report on this issue, which is currently with the Secretary of State, and I will certainly feed in those views and see what more could be done.
My Lords, isn't it absolutely essential that this government, this country, should use all the means at its disposal to get our Commonwealth partners, sadly the overwhelming majority of them, where homosexuality is still a criminal offence, to repeal their cruel and inhumane laws in accordance with the provisions of the Commonwealth Charter to which they've all signed up? Is it not impossible to organise effective health campaigns in countries where being gay is criminalised?
My old friend is absolutely right in this respect. What you need is open societies, you need good health prevention initiatives, which can only happen in open societies where people can talk about it. And you would have thought that that message would have got through. Sadly, it hasn't reached everyone, and we need to be sensitive, because at the same time as you're addressing the issues with our Commonwealth partners, we also need to continue to have access and work with them to help the people who need that help. My noble friend Baroness Verma held a very useful round-table meeting at the Commonwealth Heads of Government meeting in Valletta, Malta, last year. When the Commonwealth Heads of Government comes to the UK in 2018, I very much hope that we'll follow up on that work.
My Lords, does the Minister agree that prevention is always better than cure? And would he also agree that the advent of an effective treatment for AIDS has spread the news that it's no longer necessary to be practicing safe sex? And would he therefore ensure that prevention in the form of barrier methods of contraception, which have a double purpose, like condoms and the diaphragm, are also promoted alongside treatment for AIDS?
We'll certainly do that. And in fact, in the areas in the world where we're actually seeing the levels of infection increase, they're often in Eastern and Central Europe, where the issue is with injecting drugs. And again, good health prevention initiatives in that particular field, with that key population group, are also important. They're all part of the effort to eradicate AIDS.
My Lords, the high rates of HIV infection amongst young women in Africa in particular reflects, at least in part, their powerlessness in terms of sexual relationships. Would the Minister agree with me that this accentuates the need for DFID programmes that focus on the education and the empowerment of young women to be continued?
This is absolutely right, and it's what we're focusing on. I think I'm right in saying that it's still the largest killer of adolescent girls in sub-Saharan Africa, and we need to work much further in that area. And that's the reason why it is encouraging that the Global Fund is actually spending a large proportion of its money in low-income countries. But at the same time, we also need to provide better civil society networks, social networks, that can help young people when those tragedies happen, because if they have access to the levels of treatment, the antiretrovirals, then as my old friend Lord Pryor was saying, people can have a better quality of life here living with AIDS, and that should be more widely available in Southern Africa as well.
My Lords, good nutrition.
The Global Fund is of crucial importance across the world. Will the British government encourage the incoming administration in the United States to maintain their levels of funding and not to diminish them?
Oh, has been, we must give credit for this, and George Bush, who set it up, for the work which it has done around the world in tackling this disease. And certainly that will be our expectation. We have very close working relationships with the USAID in this particular area, and we fully expect that they will continue into the future to tackle and achieve the global goal of eradicating HIV as a public health threat by 2030.
Good nutrition is important in all of us, but it's particularly important for those living with HIV or AIDS. Can my noble friend the Minister say what is being done to ensure that there are proper trigger points when DFID is providing aid, so that nutrition is taken as a key point, particularly when treatments cause wastage,
lipid malabsorption and also other issues to do with dietary needs.
And I think my own friend is right in pointing to this, that when we're actually looking at HIV strategies across DFID's work around the world and with our partners in the World Health Organization, it's very dangerous to see it siloed. It must be something which is cross-cutting across all the interventions and all of the humanitarian responses which we have to this disease to bring hope and to prevention in terms of trying to eradicate AIDS by 2030.
Lord Cashman.
My Lords, I beg leave to ask the question standing in my name on the order paper.
My Lords, HIV treatment in itself is preventative. HIV-positive people are now being given early access to HIV drugs, resulting in an undetectable viral load, which makes it very unlikely for the virus to pass on to others. To ensure we continue to make progress in preventing HIV, NHS England and Public Health England will say more about their further plans for a new programme in the next couple of days.
I thank the Noble Lord the Minister for his response and indeed for his commitment on this issue. However, there has been much prevarication and procrastination on the issue as to who is responsible for providing access to PrEP, a drug that is known to actually prevent the transmission of the HIV virus. More people are at risk than ever before. So will the government explain how it is working with NHS England and Gilead, the supplier of the drug PrEP, to take the lead on this issue? And if the price of PrEP does not decrease, how will the government ensure that those at significant risk of the HIV virus will have access to it, and when?
My Lords, there are negotiations have been going on between NHS England, Gilead and others, and we expect to have a very positive outcome in the very near future, in the next few days. I can't comment on the details of that at this time, but as soon as we have that information, I'll ensure that it is placed into the library of the House of Lords immediately.
My Lords, I declare an interest as a former participant in the PROUD project and a former partner of mine who was HIV positive. My Lords, the reasons why some men do not use condoms are many and complex. Why will the government not fund PrEP when it has proved to be so effective in preventing HIV? And would the Minister not agree that PrEP on the NHS could potentially save the NHS money?
My Lords, I think one of the purposes of the Act promoted by my noble friend Lord Lansley was to remove the Secretary of State and indeed politicians from these sort of very difficult clinical decisions. That decision will be made by NHS England, and we expect that decision, and we expect a positive decision to be made in the very near future.
Ministers can't evade their responsibility for the NHS in the end. NHS England is not a clinical body. It is a quango, wholly owned and wholly responsible to government. The decisions they've made have purely been about money, and they're continually endorsing crude rationing of services, restriction of drugs. My Lords, in the current agreement with the drug companies, his government has received nearly 2.5 billion back in rebates from those companies. My Lords, why on earth has his department allowed the Treasury to effectively ambush that money instead of it being spent, as it should have been, on innovative new drugs for NHS patients?
My Lords, I think the Noble Lord will agree that there is a process, a clinically driven process through the specialised commissioning groups and the clinical priorities group within NHS England, which does attempt to look at all these drugs in an objective clinical way. Surely it is better that these decisions around priorities should be made by clinicians acting in that way than by politicians who are subject to all the pressures that all of us are only too well aware of. And as to affordability, of course affordability is an issue. It is always going to be an issue in assessing whether a new drug should be commissioned or not. And it always has been and it always will be. And this £2 billion that Noble Lord has mentioned before, which comes from the PPRS scheme, I think, is what he refers to, that is all taken into account when setting the overall budget for NHS England.
My Lords, one of the significant barriers to effective HIV treatment is it is often present with a co-infection such as hepatitis. Would my noble friend tell us what steps the government is taking to identify, diagnose and treat people who are co-infected with HIV and hepatitis C, the most deadly form of the infection?
My Lords, I'm afraid I can't answer that question. At least I can only answer it in a very inadequate way. So I'd like to reflect on that question and write to my noble friend as soon as I can.
My Lords, could the Minister tell us what progress is being made on the development for a vaccine against AIDS?
I don't like to have two questions on the trot that I can't answer, but I actually do not know the answer to the noble lady's question. I'll have to research it and write to her.
Could the Minister perhaps tell us what steps are being taken to ensure prisoners have access to treatment, testing and care whilst they're prisoners, because they're more likely to be drug users or, more susceptible and more likely to be from communities that don't get themselves tested or even, are in good health. Could he say something about prison health?
Well, there is a particular problem in prisons, as the noble lady refers to. There is a higher incidence of HIV in prisons for all the reasons that she alluded to, and certainly in the NICE guidance and in the PHE resources report that came out earlier today, they absolutely echo the points the noble lady was making, and I think we have to reinforce and redouble our efforts in prisons to get to identify HIV earlier through better testing.
Would the Minister agree that HIV virus is a very difficult virus, and this is one of the problems of getting a vaccine?
Well, I thank the noble lady for coming to my rescue on that. It is very difficult, as the noble lady knows, because the HIV virus is complex. And what is remarkable is the extraordinary advances being made in treating HIV. Over the last 20 years. I mean, it has been a real triumph of the pharmaceutical industry. And as I said, I will still write for the noble lady about vaccines.
My Lords, I wasn't going to refer to vaccine, I was going to refer to something else, but there was a report this morning on the radio that South Africa, they believe, have developed a vaccine which is going to actually prevent HIV. Maybe we could find out more about that in due course. But what I wanted to ask the Minister was about the question of barriers. So it seems to me the two barriers. One my noble friend raised, which is the question of stigma. And I got the impression that you felt that wasn't as serious perhaps as it used to be. I think it is still very serious. And there are very, very many examples, particularly of women who will not go to a clinic, so they create a barrier because of the stigma that is engaged. And the other point, which I think is equally important, is that local authorities who fund testing, in fact, are having so much difficulty in being able to raise the funds to do so. So maybe we should be looking at, is there some positive way in which the government can help with resources to local government?
I think this is one where government can never do enough, frankly, in this area. I mean, I think we should take some comfort from the fact that the level of undiagnosed HIV is coming down, consistently down. It is now down to 13%. I mean, we are within touching difference of the WHO's 90% level. So we are making progress, but I do accept that what the noble lady says, and that on the question of stigma, I'm sure there's much more we can do.
Baroness McIntosh of Pickering.
Leave to ask the question standing in my name on the order paper.
Lords, I declare my farming interest